So one thing that my opponent keeps stating that is a fact is that this is an option, not a requirement. It's not like you are being forced, okay, you're on your deathbed, this is your only option. You could still choose to do hospice. You don't have to take a pill or anything. You could still choose to be alive. So it's not like this act is gonna say, okay, you're on your deathbed, this is your only way out. If you can afford and be able to do hospice, then go for it. That's up to your choice. Another thing that was shown is that they were saying about how it's done by injections, but the act actually says that they would take 2 pills instead of injections. Also, another thing they brought up is that there was only 2 cases within Oregon where chemotherapy versus how many people have terminally ill cases. So it's like there's only 2 people who have had this happen where it's like, okay, either chemotherapy or you die. There's not a lot of people that are having these same occurrences. Another thing is the fact about the hospice care. In AARP, they showed that within 5 years, it cost about $385,000, which some of those costs incur to the family and even the patient themselves, which a lot of the patients are on Social Security. The average monthly income, according to Social Security, was about $1,300 a month. Do you think $1,300 a month is going to be able to meet that requirement when they're only bringing in about $15,000 a year, when that cost of living is almost $100,000 a year? So the costs are outrageous. Also, the one thing within the act is that the patient must be mentally competent. So yeah, they may be depressed, yes, they may be upset, but within the act, they're having 2 physicians actually be sure that they meet the criteria. They're making sure that they're mentally there and that they're not just saying pity me and they're depressed and they just want an easy way out. They're being evaluated during this process. It's not just you pick up the phone, call your doctor and saying, you told me I have 6 months to live, so I'm just gonna call it quits right now. Because the way the process works is you first must make 2 oral requests for the medication within 15-day waiting periods. So you have to request the medication 2 times within a 15-day period. So it must be like you really are at that point where it's like, okay, I'm just done. You can't just request it once and you get it. You gotta be consistent. As I said, they're evaluated by the 2 physicians, once again, to make sure they meet all the criteria and making sure that they're mentally competent of the decision they're making. So they also then have to make a written request. So like you have to actually, you yourself, the patient, if you're on your deathbed, you have to write it out. If you're not able to write it out, then obviously you don't meet the criteria. Then they have to wait another 48 hours for it to even be filled. So it's like there's still lots of waiting period. It's not just instant gratification. So it takes a process. So like I said before though, the insurance companies is not forcing this on them. The families are not forcing them because it's just becoming an option for those who are actually losing their autonomy, which like I said, 92% of the people within the Oregon, according to the Oregon Public Health Department, that's the main reason why they choose it. And also because they're losing their physical abilities is the main reason why they end up choosing it. Thank you.